Hello, my name is CJ Alexander, and I'll be covering shingles, aka the herpes zoster disease. Shingles, also known as herpes zoster, is a viral infection caused by the reactivation of the varicella zoster virus, the same virus responsible for chickenpox. After the individual recovers from chickenpox, the virus remains dormant in the nerve cells. However, under certain conditions such as weakened immune system, aging, or stress, and other factors, the virus can become active again, leading to development of shingles. The varicella zoster virus, the infectious agent for shingles, and the same infectious agent for chickenpox, is highly contagious and primarily transmitted through respiratory droplets. Initial infections result in chickenpox, a common childhood illness characterized by an itchy rash and fever. After recovering from chickenpox, the virus doesn't leave the body. Instead, it enters a dormant state, where it lies latent into the dorsal root ganglia. The virus itself exhibits a complex structure composed of an ecosagral nucleocapsid containing a double-stranded DNA genome. The nucleocapsid is surrounded by a lipid envelope embedded with viral glycoproteins. These glycoproteins play a crucial role in the virus' ability to enter and exit a host cells. The taxonomy of the virus is that the subfamily of it belongs to the alpha herpes virinae, and the genus for it of it belongs to the human herpes virus 3. So the best comparison between chickenpox and shingles would be shingles would be the direct sequel to chickenpox. Shingles will not happen without the person first experiencing chickenpox. So chickenpox. So I think it'd be best important to talk about the difference between chickenpox and shingles and the relation between them. Chickenpox is the initial encounter with the varicella zoster virus, highly contagious and particularly affecting children. The hallmark of chickenpox is a widespread itchy rash that covers the various parts of the body, including the face, chest, and back. The rash begins at red spot and progresses to fluid-filled blisters. In contrast, shingles occur when the virus reactivates later in life, typically around after the age of 50. The shingles rash is more localized, often appearing in band-like patterns on one side of the body or face. This reactivation is commonly associated with factors like aging, stress, or weakened immune system. Shingles manifest through a distinctive set of symptoms and signs. Before the characteristic rashes appear, many individuals experience prodromal symptoms, which serve as early indicators for shingles. These may include tingling, burning, or itching sensation in the affected area. Flu-like symptoms such as fever, headache, and fatigue may also precede the onset of the rash. The hallmark of the shingles is the development of a painful rash. This rash typically appears in a band-like or strip-like pattern on one side of the body or face, corresponding to the dermatome supplied by the affected nerve area. And the most common dermatome that it will appear on would be the thoracic dermatome. So it will appear on the chest, trunk, or the back. The rash progresses through several stages, starting as red spots that evolve into fluid-filled blisters. These blisters eventually crust over and form scabs as the rash heals. Pain is a significant component of shingles and often precedes the appearance of the rash. The pain associated with shingles is described as sharp, stabbing, or burning and can be intense. This neuralgia, known as postherpetic neuralgia, can persist even after the rash has healed, impacting quality of life for individuals infected by shingles. The affected area may become highly sensitive to touch, even light pressure such as clothing, brushing against the skin, such as my cat, such as my jacket right here, can cause discomfort. This heightened sensitivity is a common feature during the active phase of the infection. And while pain is a predominant symptom, some individuals may experience itching in the infected area. It's important to resist the urge to scratch, as this can potentially worsen the rash and increase the risk of secondary bacterial infections. In addition to local symptoms, shingles can induce systemic effects. Individuals may experience general malaise, fatigue, and fever. These symptoms reflect the body's overall response to the viral reactivation. Duration of shingles symptoms can vary. While the rash typically heals within 2 to 4 weeks, pain, especially in the case of the postherpetic nucleus, can persist for months or even years after rash has resolved. Seeking timely medical attention is crucial for the effective management and symptom relief. So we know the signs and symptoms for shingles, but it's time to get underneath the skin to see how shingles affect the nerves, as the shingle virus stays dormant in the nerve tissues. If your immune system grows weaker, the virus reactivates. As the virus becomes active, it spreads through the spinal cord nerves to the skin. These nerves convey messages of pressure, itching, and pain. These messages transfer from the spinal cord to the brain. Once the varicella zoster virus gets to the nerve ending, it shows up as a skin rash, and later shows as a cluster of vesicles and blisters. One of the key aspects of shingles that significantly contributes to its symptoms and discomfort is the inflammation of the nerves. As the virus reactivates, it travels along the nerve pathways, leading to a condition known as neuritis or inflammation of the nerves. It typically follows a specific nerve root, causing irritation and inflammation. This inflammation occurs in the nerves near the surface of the skin, contributing to the distinctive characteristics of shingles, such as the pain and the rash. And the inflammation of the nerve is a major factor in the intense pain associated with shingles. Beyond the physical discomfort, inflammation of nerves can significantly impact an individual's quality of life. Routine activities such as dressing, bathing, or even the touch of clothing on the affected area can become sources of considerable pain. Sleep disturbances may also occur due to the heightened sensitivity in the inflamed pathways. Managing the inflammation of nerves is a crucial component of shingle treatment. Antiviral medications, when administered early in the course of the virus of the illness, can help reduce the viral replication and subsequently alleviate the nerve inflammation. Pain management strategies, including over-the-counter anesthetics and prescription medications, may be recommended to mitigate discomfort. In several cases, medication specifically designed to address nerve pain, such as anticonvulsants or certain antidepressants, may be considered. As the body's immune response gains control over the virus, the inflammation of nerves in shingles typically begins to subside. The gradual resolution of nerve inflammation corresponds with the healing of the rash and improvement of the symptoms. However, the duration of this process can vary among individuals. There are several risk factors that increase the chance of the varicella zoster virus reactivation and subsequent development of shingles. One of the primary risk factors for shingles is age. The likelihood of developing shingles increases notably with advancing years, particularly after the age of 50. As the individual's age, the immune system may not function as efficiently, making it more challenging for the body to suppress the reactivation of the virus. Conditions or factors that compromise the immune system elevates the risk of shingles. Chronic illnesses such as HIV, AIDS, autoimmune disorders, or receiving immunosuppressive medication, as in the case of organ transplant recipients, can weaken the body's ability to control the reactivation of the virus and lead to development of shingles. Stress is often a potential trigger for shingles. While stress itself may not directly cause the reactivation of the virus, and can weaken the immune system, which creates the environment for the virus to reactivate. Environmental factors such as exposure to pollutants or other toxins may also play a role in influencing the immune system. And the number one risk factors is individuals who have previously been exposed to chickenpox are particularly at risk of developing shingles. After recovering from chickenpox, the virus remains dormant in nerve cells. Factors such as age, stress, or immunosuppression can lead to the virus reactivation, triggering the onset for shingles. So, no chickenpox parties at this point. While shingles typically follow a course of rash development and resolution, certain individuals may encounter complications that extend beyond the standard progression of the illness. Some of these potential complications and their implications will be post-herpetic anuclear. This condition is characterized by persistent pain in the affected area even after the shingle rash has healed. The pain may range from mild discomfort to severe and can last for weeks, months, or even years. This nuclear can significantly impact an individual's quality of life, making daily activities challenging. Shingles can also infect various parts of the body, and when it involves the eye, it leads to a condition known as ophthalmic shingles. This can cause symptoms such as redness, swelling, and pain in the eye. This requires prompt medical attention as it can potentially lead to complications such as vision impairment or even blindness if left untreated. In addition to that, the open sores and blisters associated with the shingle rash can provide a portal of entry for bacteria. Secondary bacterial infections such as cellulitis and impetigo may occur if the infected area are not kept clean and properly cared for. Prompt medical attention is essential if signs of infection such as increased redness, swelling, or discharge develops. And in some cases, shingles can result in neurological complications, particularly when the virus affects the central nervous system. Meningitis, inflammation of the membrane surrounding the brain and the spinal cord, and encephalitis, inflammation of the brain itself, are rare but serious complications that may require hospitalization and intensive medical care. While there are no direct ways to treat shingles and the virus, there are ways to mitigate the effects and to prevent the virus from happening, such as topical ointments that would soothe the pain and severity of the rash coming from the shingles, and the Sotofex vaccine that will prevent shingles entirely, in addition to chickenpox. One important thing that is to note is that no chickenpox parties to prevent the onset of shingles, which is the onset from chickenpox. Thank you for watching my presentation on shingles. And if you have any questions for me, please address those questions to the disease panel, and have a good day.